everyone, I'm student nurse Angelica Contreras from BSN 212A Group 2. Today I'm going to demonstrate perineal flushing. We perform perineal flushing to patients who are bedridden and dealing with incontinence or who have an indwelling catheter. It is important to wash this area properly as doing so allows us to deter the breakdown of sensitive skin. To start off, the materials we need are container filled with warm water, clean gloves, 2 kidney basin, 7 pieces dry cotton balls, and also 7 pieces cotton balls soaked in cleaning solution, bedpan, newspaper, rubber sheet, working and pick-up forceps, and perineal pad, which can either be maternity napkin or adult diaper. Next, we're going to provide privacy to the patient, like locking the door and closing the curtain, or using a screen. So before we meet the client, we need to perform hand washing to deter the spreading of microorganisms. Now that we are done washing our hand, we're going to meet the client. So first is we're going to introduce ourselves to the client and identify the client's identity. This is to ensure that we have the correct client. And also we're going to explain the procedure to the client so that she is aware of what we are going to do and can cooperate comfortably throughout the procedure. So now let's meet the client. Hello ma'am, good morning. I am student nurse Angelica Contreras from Davao Doctors College. Can I check your wristband?
Sure.
Okay. Can you please state your full name and date of birth?
So my name is Angelica. My date of birth is November 18, 2002.
Okay, thank you. And how would you like me to address you?
Just call me Mel.
Okay, Mel. Are you with someone right now?
No.
Okay. Do you know what are we going to do today?
Yes. We're going to wash my private area.
Yes, so today I'm going to do perineal flushing. This is to prevent infection or contamination from the rectum, okay? So this will involve me touching your private area and exposing it. Is that alright with you?
Yes.
Okay, rest assured that no one else can see you. Your privacy is secured because I have already locked the door and closed the curtain. So, is that okay?
Yes.
Okay, so before we proceed or start, do you want anything else or are you uncomfortable somewhere?
No.
Okay. Okay, so before touching the client, it is important to wear gloves to prevent infection. Next is we're going to position the client in a dorsal recumbent to provide comfort while doing the procedure. For minimum exposure and to lessen the embarrassment of the client, and also to provide warmth, we are going to drape the client's body and leg and expose only the private area. Then we are going to place the rubber sheet and bedpan under the patient's buttocks. This is to prevent the bed from getting soiled or becoming soiled. So, now can you flex your knees? Okay, thank you. Can you please lift your hip? Okay, for a while. Okay, go. Lift your hip again for me, please. Okay. Are you comfortable?
Yes.
Okay. Okay? So first is we're going to inspect the perineum for any inflammation, swelling, excessive discharge, and etc. Okay? After that, we are going to flush the perineal area with warm water to prevent chilling and soften blood clots. But before that, we need to check the temperature of the water if it is not too warm and not too cold. We're also going to let the client check the temperature of the water. So we are going to use our elbow when checking the temperature. Okay? Can you please check? Is it okay?
Yes.
Okay. So, to maintain sterility, we are going to use pick-up forceps when getting the cotton balls that soak in a cleansing solution. So first, we're going to cleanse the external genitalia, starting from the midline of the symphysis pubis down to the anus. We should never retrace a stroke, so it should be only one stroke. This is to prevent contamination of the area. So like this. Then we're going to discard it. For the second cotton ball, we're going to cleanse first the labia majora. So, on the right side first. Like this. Then, we're going to do it by the figure of 7 by way of external labium towards the anus. Then, we're going to discard. We're going to do likewise on the other side. Okay, so this is for secretions that tend to collect around the labia minora, facilitate bacterial growth. Then, another cotton ball. The next is the labia minora. So on this side first, then discard. The fifth cotton ball, we're going to do it likewise on the other side. The labia minora up into the anus. So with another cotton ball, we're going to cleanse groin, starting from the groin, going up to the thigh. Like this. And use another side of the cotton ball for near groin. Now we are done. We're going to flush the perineum using the warm water. Then we're going to pat dry it using the stroke when we clean it. So first like this. Then discard. The second cotton ball in the labia majora up to the anus, then discard. On the other side, Okay. Then the labia minora. Then lastly, now we are done. What we're going to do next is we're going to remove the bedpan and turn the patient to the side. Mel, can you lift your hip? Okay. Okay. You can put it down. Can you please turn on the side? Okay. So if necessary, we're also going to clean the buttocks of the client. So we're going to put back the client in a comfortable position. Okay, Mel, you can comfortably lay down. You can put your feet down. We are now already done. Okay. Okay, now. To promote healing, we're going to spray antiseptic as needed on the patient's vaginal area. Can you please flex your knees again for a while? Okay. Now we're going to put the perineal pad with an up-down needed. This is to prevent contamination of the urethra from the anal area. Okay, now I'm gonna put the maternity pad, okay? Now we are going to do the aftercare of the materials that we have used, and we're going to discard the gloves and document all the findings that we find. But before that, we should not forget that we are going to perform hand hygiene after doing this procedure to deter the spreading of the microorganism. So the things that we are going to record are the treatment that we have done to the patient and any unusual findings such as redness, excretion, skin breakdown, discharge, or any drainage and other things such as that. It is for documentation purposes that the procedure was done and means of communication.